Good evening. I'm here today to talk to you about deep vein thrombosis, also known as a DVT, that can be a complication while patients are in the hospital. Um, a DVT is when a blood clot or a thrombus forms in one or more of the deep veins in your body, usually in your legs or your arms. If it becomes more or migrates up to your lungs, it's then called a pulmonary embolism. Deep vein thrombosis can occur when patients are in the hospital, either from lack of movement or not getting out of bed and walking like they should, and this is why they can get deep vein thrombosis. Some signs and symptoms is if a patient complains that the site, either the arm or leg, is super red, has some warmth to it, or if they're complaining of pain, a lot of times this is the first signs of a DVT. Also, whenever this starts to happen, a physician should order a ultrasound to see if a DVT is present. Some causes for this is that, like I said, that the patients are not being ambulatory post-surgery, and that one of the medications that each patient, especially post-surgery, should be on is sub-Q heparin, and a lot of patients think that it's a medication that they don't really need, and so they'll refuse this medication. And the sub-Q heparin is actually really beneficial because they're not moving around like they normally would prior to surgery or being in the hospital, and so blood clots are more prevalent while they're in the hospital. So whenever the patient starts complaining of a DVT and they get this ultrasound and it comes back positive, the first line of treatment is to get the patient on a medication. So that first medication line that they would need to be on is a medication called heparin, and it's going to be a heparin drip because there is no oral medication for this patient to be on, because heparin is not absorbed orally, and therefore it must be absorbed by the IV. It's reduced by the IV and subcutaneously, with reduced bioavailability by the subcutaneous route. So the thing with heparin is, unless a patient, the good thing, so for nurses who are doing heparin, unless a patient is obese, then the starting rate when you do heparin is always going to be the same. You're always going to start it at the same dose, which is 18 units per kilogram per hour. And at the time of starting it, you get a baseline APTT lab draw, and then every 6 hours, the patient's going to have to get stuck and get an APTT. And according to that APTT, you draw it and you dose that accordingly to see if it's therapeutic or not. Once the patient is therapeutic, then they're going to get off of the heparin, and then you want them to stay anticoagulated. So you're going to start them either on warfarin or Coumadin, and they may be on that for a period of time just to keep their blood thin, and it'll help them keep their blood thin so that they don't coag again or get another DVT. So for a small amount of time, they will be on an anticoagulation even when they get home. Whether that is warfarin or Coumadin, it's going to depend on which one their body reacts to better. And I'm Randy Saplina, and that is what I had to discuss with you today about DVT, which is deep vein thrombosis.